Good afternoon, everybody. I'd like to welcome you to the second session of the day. The session will be about the health costs of war. I'm Yusuf Khadr. I'm Professor of Epidemiology and Biostatistics, and I'm the Dean of the Faculty of Applied Medical Sciences at Jordan University of Science and Technology. There will be 4 speakers, distinguished speakers, who are going to talk about the health costs of war. We will leave the questions to the end of this session. Now I would like to let Balsam introduce the first speaker.
Okay, I'm Balsam. I'm a specialty registrar of public health, training to become a consultant for public health medicine in the UK. I'm presenting now Jane Gilbert, who is a consultant clinical psychologist. Jane actually's early career was a clinical psychologist within adult mental health services in the UK. She currently works as an independent consultant. Her specialty is design and facilitation of workshops on psychological and mental health issues in cross-cultural contexts and consultancy to international non-governmental organizations. Okay, Jane, you are welcome to start, and I'll give you a 5-minute warning towards the end.
Okay, thank you very much. It's lovely to be here, and this session will be a bit different from the sessions so far, which have been more academic. I want to begin by saying thank you particularly to Lana and Anthony, who have sent all these helpful emails in terms of getting me here and being here at this conference. There's been some excellent talks this morning, particularly by Rita and Tanya, on some of the issues I'm going to mention. And it's really difficult to think about how to talk about global mental health issues in such a short space of time. And the issues have many layers and are intertwined. But all of the concerns that I'm going to raise have been discussed in a very detailed way by many different commentators. I have many documents and papers on my laptop, which I'd be very happy to share with anyone who is interested, and also the last slide will have some resources. But before we begin, I'd like to involve you, so please, if you can possibly do it, can you find a pen and paper rather than your electronic devices? I know many of you are still attached to electronic devices, but if you could find a pen and paper, that would be really helpful. And I'd just like to take a few moments to think about ourselves, because the suffering of those involved in war, for me, is beyond words. I can't, whenever I have a conversation with anyone, I can't find any words. But if you could find a pen and paper, I'd be really glad. And I forgot to mention at the beginning that I submitted the abstract in August this year for this conference. But since then, without understanding I would do so, I spent 2 months in Gaza, September and October. So I am going to use that experience today. And obviously, our first amazingly wonderful keynote speaker this afternoon spoke about those issues very passionately. So I'd like you to think about a scenario. Imagine that you and your family have been in Gaza City throughout the 51 days of bombardment. And you've been very fortunate, none of your relatives have been killed or injured, but you are actually, there's now the ceasefire, and you are returning to your house for the first time. So maybe you are returning to this apartment, right? I'd like you to, very quickly, because we're short of time, what kind of feelings and thoughts are you likely to have, right? So just quickly, either in your mind or make a note. What are you likely to feel at this point? Or your house may be this. This is maybe your house. So I'll just give you a few moments for that, please. I apologize for the lack of time, but it's this kind of conference. And we'll come back to this later. And do continue to think about this while I'm talking, and you can add to your list of what kind of thoughts, feelings and reactions are you likely to have at this point. So let's think about the movement for global mental health. How was it established? It was begun by the publication of a series of articles in 2007 in The Lancet, which is a British medical journal. But it's grown exponentially and is now a worldwide movement with 600 members, 4,000 members in more than 60 countries. And it exerts substantial international influence. And at first sight, this seems a really good idea, putting mental health on the international map. And the work done so far, which highlights discrepancies in mental health provision between different countries and argues that mental health problems are very prevalent and need more funding, and also there's a treatment gap that Tanya already mentioned this morning. And that the response to that treatment gap is by scaling up, as they call it, Western-style interventions. And that may also, at first sight, seem a good idea. But this has been extremely controversial, this worldwide movement, and there are very profound differences between very respected professionals about this. The fundamental controversy is whether the type of mental health services in Western high-income countries should be scaled up worldwide. And again, this is a very short talk, so we are going to just focus on two very small issues. One is diagnostic systems, which has already been mentioned this morning. In fact, there's a lot that's been mentioned already, which makes it easier for me this afternoon. And the other will be language and culture. So the movement for global mental health is underpinned by Western psychiatry and the assumptions that go with that. And one of the assumptions is about diagnosis, and all the medical people here will be familiar with the notion of diagnosis. Symptoms are identified, and then that determines it's a particular disorder, which then determines the treatment. And again, as Tanya already mentioned this morning, people use what's called DSM for short, the Diagnostic Manual, it's a long word, Diagnostic and Statistical Manual of Mental Disorders. The first edition was in 1952, and the fifth edition, DSM-5, was last year. And that resulted in the addition of new disorders that hadn't been there before, and again resulted in a huge amount of controversy. Even my professional organisation, the British Psychological Society, objected to it, and they are not a political organisation, so that was a big surprise. But of most relevance for the overarching controversy in relation to scaling up mental health services is that this diagnostic system is a product of Western culture, and its primary focus is on locating problems within individuals. So what's this got to do with people affected by war, you might ask? And one of the ways that they're really very incredibly important is that they are the basis of questionnaires which are often administered to establish the mental health needs, so-called, of war-affected populations. And the prevalence of what are usually called mental disorders, as Rita already mentioned today, is usually estimated by asking respondents to complete a checklist. So people tick off whether they are experiencing disturbed sleep or they're not eating or whatever. And a person showing certain kinds of symptoms of disorder, depending on the cut-off point, is decided in terms of what they're suffering from as a disorder, with a name, whether it be depression or post-traumatic stress disorder or whatever. And there are many publications along these lines of percentages of people who are suffering from these things. But can we go back to your feelings about the destruction of your house? All right? I don't know what you've written there, and I would love to know, but we don't have enough time. Would someone who asked about your symptoms understand the experience you had lived through? Would a list of symptoms reflect your worries and your terrors for the future, and your fears for your children, and how you're going to live? And more importantly, how you're going to make sense of what has happened to you. There are many difficulties with this type of questionnaire, but the most crucial is that these kind of checklists cannot identify normal reactions to abnormal situations, right? Which is the situation for anyone affected by war. questionnaires used also have other problems. When I was in Gaza, I was amazed, but quite heartened, to receive a document published by the local WHO office at the end of August, which is just the end of the conflict and the beginning of the ceasefire. There's not time to quote this verbatim, but the gist of the document was asking international organisations not to carry out any more mental health assessments and warning them of the following, and this is a quotation directly from this document. Most assessments take place during the first 3 months after the war, usually using various international tools which may not have been validated locally or within the emergency context. The majority focus on the prevalence of disorders, and this is the bit I found amazing. However, these assessments rarely take into account that distress tends to be a normal manifestation of a community affected by a disorder, by an emergency. And this often leads to reporting of extremely high prevalences of mental disorders in the immediate aftermath. And I was astonished, why don't people know this? Why do international organisations need to be told this? Of course, people are going to be distressed as a natural and normal response. And again, when we go back to what you perhaps thought about what you might feel in this situation, right? What are you going to feel? Rage, actually. The people that I met in Gaza were sitting with huge amounts of rage that they were bombed with no escape, and this is happening to them. Well, you all know about it, right?
5 minutes, James.
Language, culture, right? Very briefly, it's been mentioned already, but basically the language we speak determines on how we understand the world, right? And I hope that when you've been writing your own feelings, you've been writing in your own language, right? Because how we think and process in our mind is all about your own language. And there are many different nationalities here, and in your heart and in your soul, you will think about your feelings in whatever language is right and okay for you. And that many languages, as already been mentioned today, have no equivalent words, right? So again, we come back to the problem with Western diagnostic systems, which are culture-bound, and also English, right? So again, all translations across cultures are very problematic. So a very brief taste indeed of some of the issues in global mental health that are very controversial. But I just want to, if I have time, just to conclude with two real paradoxes here, right? One is about who is calling for using human rights as a justification here. The call by the Movement for Global Mental Health to increase access to psychiatric interventions because of the treatment gap, and the call from the people who wanted to abolish all these diagnostic systems altogether, use the same justification, that it's a human rights issue, okay? And the same reality is looked at very, very differently. And I'll leave the other paradox for another time, right? But the international aid sector, I think, is a bit far ahead, a bit more ahead in these issues. And in recent years, there's been a great focus on psychosocial programs. The ISC guidelines, which you probably know, on mental health and psychosocial support, printed in 2007, were an explicit attempt to bring together mental health and psychosocial under the same umbrella. And there is an assessment that was produced in 2012 only by WHO and UNHCR that is much better. It still looks a little bit at symptoms, but it focuses much more on daily functioning, how people are functioning, and mapping available resources. But the suffering of war is caused by political forces, which was expressed so eloquently this morning. And safety is fundamental for psychological well-being. And as long as there's no safety, then people will experience obvious distress. And the stresses and distresses are multiple, and everything has to be understood within the context in which it occurs. The other thing that is somehow forgotten, that the losses just are exponential. Loss of place, loss of belonging, loss of identity, loss of an imagined future, and this was very pertinent in all the people that I had the privilege to work with in Gaza, but somehow imagining a future where they could get out of Gaza and live another life was actually something that people dreamt about or hoped about in a distant future. And this business of grieving over loss is given very little attention when people talk about people in these circumstances. And I think that's about all, but I would just like to just point out some additional resources and say I'm very happy to give away all of mine, of which I have loads. This is an excellent journal, Intervention, right? It's available online. The back issues are free, right? It's a practitioner's journal for people working with war-affected populations. The online forum for practitioners is mhpss.net, which some of you may already know. Again, loads of resources if you're interested in this area. And I'd better stop talking now. Thank you.